Hi, I'm Lauri Kane from the Plastic Surgery Office of Dr. Dean Kane in Baltimore, Maryland. We're a huge user of Scupltra in our office. And a lot of people come to us because we're such a huge user. We use it in the face, we use it in the décolletés, in the arms, in the buttocks. So we use quite a bit. But there are people who say, well, I've heard some negative things about Scupltra. And so I start to explain the history of Scupltra, why there is some negative information regarding Scupltra and why today we don't have those issues. So real briefly, Scupltra was FDA approved in 2004 during the time that the HIV/AIDS patients were recovering, but yet they were having a lot of hollowing in their face. And so this company recognized that Scupltra would be perfect to stimulate collagen elastin in these particular patients who had the wasting and hollowing and thinness in their faces. However, at that time period, it was so new that they didn't really quite have the reconstitution properly that we do today. They did recommend massage that we do today. And also the way they injected, they took a full syringe and just filled in the cheek, and that's what really did create the lumps that people did develop in that time period. So time elapsed, and then the company realized that they had to change the way Scupltra was being reconstituted. And today, the way it's done is that we reconstitute it about 3 or 4 days prior to having a Scupltra treatment, and the vial gets reconstituted with saline solution. That's one very distinctive difference. It gets 3 or 4 days of being diluted or reconstituted. The way Dr. Kane injects, which is a really important factor in terms of choosing your Scupltra doctor, that he really went around the United States to the different experts in the field of Scupltra to really understand how they were injecting Scupltra. And what you really want to do is you can have full face injections, which pretty much that's what we do here. He almost creates a grid on the whole face so that when you inject Scupltra into the whole face, the entire face is stimulating your collagen elastin. So the results are that you get this really creamy, firm, tight looking skin. There is such a thing as targeted Scupltra, and we will do that for just very specific areas after people have had almost their full Scupltra. So those could be touch-ups. That's not generally how we start with Scupltra. And then the third is massage. The Scupltra company has the 5-5-5 rule. I think Dean has like the 7-7-7 rule because he really believes in massage. And so the goal is that 5 times a day, you really sit there for 5 minutes a day for 5 days and massage in the Scupltra. And all of these factors, the reconstitution, the equal distribution of how it's injected, and then the massage has reduced the potential risk of forming these lumps or bumps. The ones that we do get occasionally, which are very, very tiny, generally you don't see them, you actually just feel them. Generally, all you have to do is really massage them out. So it's again, the history of the old way Scupltra was used is so distinctly different than the way we use it today. And then also we decide whether you're a good Scupltra candidate. Are you a Scupltra candidate versus a filler? Do we do combinations, of which we often do? So we're very, very proactive when it comes to Scupltra and injectables, and we really personalize it to your face. So if you're interested in Scupltra, give us a call, 410-602-3322.